Hi, I'm Jazz. I'm a student nurse with Griffith University, and today I wanted to chat about something that isn't talked about enough. It's how tough it can be when somebody from the country has to travel for cancer treatment to the city. It's a huge deal. You're away from your support network, your home, the people that you love, and you're dealing with one of the hardest things that life can throw at you. So let's take a few minutes to unpack some of the biggest challenges that you may experience and go over a few tips and tricks to see if we can make that a little easier. Number one, information overload. You're going to be given all of these test results, treatment plans, new words that you've never heard before. And it's a lot when you're already under so much stress from your daily life and traveling. So, what might help? Number one, take someone with you to appointments if you can, or get the doctor to call them up during the appointment. They can help take notes or just be there when you need that moral support. And an extra pair of ears can be really important at times. Number two, you can record your consultations with permission. That way you can go back over it and just double check some of that information that you might have skipped over before. Three, always ask questions. Write them down before you get to your appointment so you don't forget. And just remember that there's no question too small. Number four, use trusted sources. Not everything on the internet is reliable, so make sure you stick to trusted websites like the Cancer Council, because they will have the information that you need. And if in doubt, you can always ask a nurse. They're always happy to help. Next up, money. So it's not just the medical stuff, it's travel, fuel, accommodation, food, parking, and sometimes you can't even you can't even work while you're away. So it all adds up. So here are a few resources that you can use. First up, check if you can get support through your patient travel subsidy schemes. Call up your local hospital to find out more. Now, pro tip, sort that paperwork out before you leave home. So that way when you get to your appointment, you can focus on yourself. Next is always charities like the Cancer Council. Sometimes they have that volunteer support that can help with accommodation or travel. And lastly, always ask if telehealth is an option. Sometimes a phone or a video consultation can save you a very big trip. Alrighty. Lastly, mental health. So, getting a cancer diagnosis is a shock. And then on top of that, you've got to leave home for treatment. You might be feeling scared, overwhelmed, and lonely, and that's totally normal because you're away from your support system, your family, your mates, your community, and that connection's a really, really big deal. So, here are some things that might help you keep connected. So, number one is keeping in touch with your family and friends, of course, but a video call over a phone call can be more connecting in the way that you can see who you're talking to in real time. Next, you can always join an online community or support group. Hearing from people who are or have gone through the same experience as you can be really comforting. And lastly, the hospital counsellors are always there to listen and support and potentially refer you on. Alrighty, so that was a bit of information overload from myself. So let's go through and do a quick recap. So, learn how to do video calls before you leave home, sort out your travel paperwork early, take someone with you to your appointments. It can be a friend, a family member, a good neighbor. Ask questions, even the small ones, and use trusted websites. Again, Cancer Council is one of your best sources. And of course, check if telehealth is an option. Thank you.